Have you ever imagined that one ordinary morning you walk into the clinic just to get a pain-relieving injection? 15 minutes later you left there in a wheelchair. Not because of an accident, not because of illness, but because of a shot. A shot off by 1 millimeter. And then, half of your friend became paralyzed. Forever. Can't stand up, can't go to work, can't go to the bathroom on my own, can't live like a human being anymore. This isn't a movie. This is true. A tiny mistake in medicine can take a life. I am Dr. Late Life, the doctor who tells stories no one wants to hear, but you need to hear. If you love real-life medical stories that are chilling but full of lessons, please subscribe to the channel. Because who knows, something today might save you tomorrow. I met him on a late autumn afternoon when the sky outside the window hung low and gray, just like the mood inside the hospital. He was barely in his 20s, face pale as paper, his left arm limp across his lap. His voice trembled slightly as he spoke, like someone who had just awakened from a nightmare he knew he'd never escape. I didn't know him, but I understood that look. Because before I became a doctor, I too once sat on the other side, next to a hospital bed. And I've seen those eyes before. The eyes of someone stripped of the right to live an ordinary life. He used to be an EMT, an emergency medical technician, a noble profession. Every day on the job was a dance between life and death. He was once the one saving lives, but a simple procedure made him the one needing to be saved. It started with a small cut on his right arm, from a shard of glass during a car crash. At first it looked like just a scratch, a few stitches, nothing more. But weeks passed. The pain didn't fade, it flared, spread like wildfire down his arm, like a frayed electric wire sparking inside him. Even brushing against his shirt sent lightning bolts through his nerves. He couldn't eat, couldn't sleep, couldn't do anything. Doctors suspected a neuroma, a nerve tumor. So they sent him to a pain clinic. There, they recommended a common treatment, cervical epidural steroid injection. In plain terms, an injection near the spine to calm inflamed nerves. Sounds simple, but if you've ever studied medicine, you'll know. The neck is one of the most dangerous places to insert a needle. Just a few millimeters off, and you risk paralysis, loss of sensation, or even death. But that clinic, motivated by profit, didn't stop at one. They injected him 5 times. First time, no effect. Second time, still in pain. Third, hang in there, the doctor said. Fourth, a slight numbness, but no relief. Then came the 5th. That's when everything shattered. That day, there was no doctor in the room. A technician, not certified to perform the procedure, took over. No imaging, no ultrasound, no guidance screen, just a blind needle into his neck. Instead of placing the steroid outside the spinal cord, where it should go, the technician pierced the center of his spinal cord. And instead of a clear liquid, they used particulate steroid, filled with microscopic particles like dust. Once inside the spinal cord, those particles clogged the tissues. They triggered inflammation, necrosis, and destroyed his nerves. He let out a soft gasp, and then silence. His left arm went numb. His left leg collapsed. His eyes widened, his mouth opened, but no words came out. And just like that, half his body would never move again. He was rushed to the ER, but what had been done could not be undone. 3 months later, I saw him again. No longer the strong young man from before. His left arm, completely paralyzed. His left leg could only shuffle a few steps before collapsing. He wore a catheter bag. His bladder had stopped working. No more sleep, no more hope. Every night he dreams of being injected again. He feels the needle puncture his neck, feels his blood freeze in his spine, feels his body slipping away, bit by bit. Doctors gave it a name, Brown-Séquard syndrome, a rare spinal cord injury where one side of the body is paralyzed while the other loses all sense of pain and temperature. The entire procedure that day was wrong, from beginning to end. No doctor overseeing it, no medical standards followed, no consent. He was just a victim of the system, a system that sees patients as walking wallets, a system where greed outweighs ethics. Yes, the clinic was sued. But you know what? No court ruling can give him back his body. No amount of compensation can buy back the days he watched his friends charge into danger while he sat in a wheelchair. The day I said goodbye to him, he said only one thing: "Doctor, just don't let this happen to anyone else, not even one more." And I promised. I share this story not to scare you, but to warn you. A warning that sometimes the most terrifying thing in medicine isn't the disease. It's the carelessness, the ego, the greed, the shortcuts that happen every day behind closed doors. And you have the right to know. You have the right to ask, what is that medication? Who's doing the procedure? What are their qualifications? Is there imaging guidance? Modern medicine can save your life, but only when it's done right, by people with conscience. If this story made you pause, please share it, because somewhere out there, someone is about to walk into a room just like that, and they deserve to be warned. I'm Dr. Late Life, and I will keep telling the stories no one wants to tell, because sometimes painful truth is the only thing that might save you. If you'd like to hear more stories like this one, hit like and subscribe. We still have a lot to talk about. I'll see you in the next video.